Greetings. My name is Paul Zablocki, Development Gifts Officer at Canisius High School, and it's my pleasure to welcome you to another episode of Conversations with Canisius, the web series where we connect alumni from around the world with the classrooms on Delaware Avenue. Today, my guest is Dr. William Greeley from the class of 1968. Following Canisius, Dr. Greeley graduated from the University of Notre Dame, the University of Texas Houston School of Medicine, and holds an MBA from the Facua School of Business at Duke University. During his career, he has been an associate professor of anesthesiology and pediatrics at Duke University, while serving as the chief of pediatric anesthesiology and critical care. He was a professor of anesthesiology, pediatrics, and pediatric critical medicine at the University of Pennsylvania Perelman School of Medicine, and served as the chairman of the Department of Anesthesiology and Critical Care Medicine at the Children's Hospital of Philadelphia. Since 2017, he, his wife, and 4 kids have been back in the Durham area, and he's been an adjunct professor at Duke University, where he continues his research into central nervous protection and mechanisms of injury during pediatric cardiac surgery. Dr. Greeley, it's an honor and a privilege to have you join our web series. Thank you so much for taking some time today.
Yeah, my pleasure, Paul. Thank you.
So it's been a few years since you walked the halls at 1180. Why don't you offer us some insight into your journey, both at Canisius High School and then beyond?
Yeah, so let's start. At Canisius, I developed a love for science, as well as the Ignatius role for service, and so I had this intense desire to become a physician. Some of that perhaps was modeled by the fact my mother was a nurse, and my older sister was a nurse as well. And so I left Canisius, and we can get into the details in a minute about what brought me if I had any success in my career, how Canisius played a vital role in that. So when I left Canisius with a strong desire to be a physician, I entered, as you say, I went to the University of Notre Dame, and I enrolled in a bachelor program. It's called pre-professional studies. But what I did there, what I carried from Canisius, is this notion of academically to be whole, not only just in the sciences, but in general studies, philosophy, theology, and things like that. And so what I basically did was I took the bare number or minimum of science courses to get entry into medical school, and then focused on theology, philosophy, and things like that. And that was a direct result of the enriching experience that I had at Canisius High School. Thereafter, as you noted, Paul, I went to the University of Texas Medical School at Houston, which basically at the time it's the Texas Medical Center. So all their medical facilities in the Houston areas is concentrated in this about a 10 square mile area within the city. There's nothing like it in the US and probably in the world. And what I did there, I found through medical school that I had a love for pediatrics and child health care, as well as research. I wanted to practice, but I also wanted to get involved academically. And then from there, my journey started. It was a 10-year journey of training. I first entered a pediatric internship and residency training program at Duke, and I found out I loved really the intensity of pediatric care, both in the ICU and the OR. I finished residencies in pediatrics and anesthesia, and then I did fellowships in cardiology, pediatric anesthesia, and ICU medicine. And then I joined the faculty at Duke for approximately 15 years. While there at Duke, or while now I'm back at Duke now, I built their ICU program as well as their anesthesia programs. They didn't exist back, and this was in the early 1980s. I also developed an academic training program to train others like myself in pediatrics, particularly ICU medicine. And then I developed a research career in the area, Paul, that you just touched upon, which is if you look at children undergoing cardiac surgery and cardiopulmonary bypass, back then there was a significant, we were able to get these children to survive, but then there was a significant incidence of brain injury. And so I basically went about in a systematic way of understanding the science behind it, the science of cooling, the science of perfusion. And then we basically were able to develop improvements. Today, now, if you look at today, the survival rate is, and it's pretty complex surgery, is less than 1%, and the neurologic morbidity is very minimal. So I did that, and then what I noticed was I had several mentors, my supervisors, physicians that were much smarter than me, and I realized that they weren't so good in leadership positions. In fact, two of them basically failed when put in leadership positions, and I knew that I could be the same, which is why I decided to get the MBA. I did finally, I kept putting down, I didn't want to be a director or anything else. I just wanted to practice medicine, train people, and do my research. And, I guess I was destined to do more leadership activity. And so I got the MBA, and then I kind of maxed out at Duke. And that's when I went to the Children's Hospital of Philadelphia, and then the University of Pennsylvania as a faculty there. And there I continued to lead clinical programs, the research programs, the training programs. And in fact, the Children's Hospital of Philadelphia is the first institution in North America, and it was in the 1950s, to develop ICU medicine for children. So it was a very traditional, organization, but also one that pioneered. And I was fortunate to be the second leader of that institute. My predecessor was the one that actually started ICU medicine for children in North America. And then after 20 years, I decided, been there, done that, I've done enough. It's time for somebody else to kind of take over and do a better job, perhaps, than me. And so I thought I was going to retire. So my wife and I, as you state, Paul, we came back here to North Carolina. And then I found out that I had gas in the tank, so to speak. And so what quickly happened, so I joined the faculty at Duke, and I did my, the research and the training and administrative activity. But I also started a non-for-profit organization dealing with distressed children's hospitals. And so I basically have gone into children's hospitals and gotten into trouble and try to, basically turn them around. So I did it in Charlotte, North Carolina. I've done it here at Duke. And most recently, I've been involved with a children's hospital in Florida. So that's kind of my journey. Along this journey, in terms of my faculty, I also had the opportunity twice to take sabbaticals. The first time we lived in London, and the second time was we wanted to go to a non-English speaking country. So the choices were Lund, Sweden, or Paris, France. So we took Paris. So the six of us went over there, not knowing the language or whatever. And, by the end, our kids were fluent. My wife was pretty good at it, and I consistently butchered the language. So anyway, so that was a very enriching part of this journey. And on the personal side, when I met my wife on St. Patrick's Day, during my senior year at Notre Dame, and you can imagine, with the Irish, that was a really big day or whatever it is. But as luck has it, that next summer, before I went to medical school, I had at Roswell Park Institute there in Buffalo, I had a fellowship in mycology, and so I did that for the summer. It turns out that my wife was going to live in Buffalo, but to be with another gentleman who was a former graduate of Notre Dame, and and that, so we're both ended up in Buffalo, and now after 47 years of marriage, here we are, you know, um, here we are together. So that's my my journey.
Thank you for sharing that. It's there seems to be in these stories, you know, moments of grace or just circumstance that allow for things to happen. Certainly, your future wife, finding her way back to Western New York worked out in your favor.
Yeah, yeah, oh yeah, yeah.
So part, one of the core, parts of Canisius High School, and you talked about it a little bit in what inspired your curriculum choices at Notre Dame, is the Jesuit, philosophy and the guidance from Saint Ignatius, right? His spiritual exercises and Ignatian formation is a huge part of the individual growth of a young man in their time at Canisius, and certainly something that doesn't stop when they graduate from Canisius. Can you talk a little bit more about what being a graduate of a Jesuit high school has meant for you personally in your work, and what the greater glory of God, or some of the more modern themes like men and women for and with others. What do those mean to you and have meant for you in your career?
Yeah, so if you look at the Ignatius formulation, I think there are 6 principles, as I recall, and 4 of them really played a key role for me back then during high school, and then in my ensuing life and career. The first one was to consistently strive for excellence. Use your gifts and do not settle. So that's certainly been a part to get through my journey, particularly during all that training. You have to be focused, and so it was to try to be your best. The second, I think, principle is the whole notion of Ignatius about social justice, and we're all given these gifts and blessings. I got from my parents, the opportunity to go to Canisius High School and then Notre Dame. But it's the notion that with these gifts, you got to turn it into something. They're not self-fulfilling in and of themselves. You have to, to really reap the benefits, you got to provide service and service to others. And for me, the beauty of all this has been my role as a physician.
You had talked a little bit about social justice being an important piece of your, in your own career, in your own life. Talk a little bit more about what social justice means.
For me, it's doing it's doing the right thing all the time, and doing it in a way that others that they get it. So it's the provision, of in my profession, the provision of care, whether or not someone, a child, or the family can pay or not, to basically render that care, and then secondarily figure out whether or not they can pay. Things like that, I think are exceedingly important.
Earlier you talked about the being conscious of the lack of leadership from some of your mentors, and you've been able to find yourself in and earn leadership positions both at Duke and then at the Children's Hospital of Philadelphia. Talk to me about what you saw missing from those other individuals, and how you turn that into kind of a inspiration to reach the levels that you were able to.
Yeah. So that, yeah, so what I saw lacking in myself and others. So when you're trained as a physician, you tend to be autonomous in your practice. It usually is one-on-one, what you want with your patient. You do it alone. You don't function as a team. You tend to, because each patient is very different. You don't know what's going to happen, particularly in an ICU and OR environment. It's better to be reactive and flexible than it is, you're well prepared, but you always get knocked off because each patient is different. So you come in with this reactive mindset. And if you think about it in a business setting or in an administrative setting, if you're autonomous, you don't work well as a team. Um, um, it, those aren't the skill sets that are required to be, I think, a leader and to lead. Physicians typically think, we're the smartest people in the room, which is another issue. So I learned early on, which is why I got that MBA, that soft stuff matter, like teamwork, communication, and things like that. And physicians are basically handicapped. So we have to bracket how we're trained and then develop this other a skill set. One of the other Ignatius principles is the whole thing about teaching from experience, and that's what I've been able to do after 35, 40 years. I've had these leadership moments, I'll call it. Some have been very successful, despite all odds, and then other times I've failed, and so it's important to, with trainees and other young faculty, individuals like that, what you do, you have to talk about these moments. And so when I give a lecture on leadership moment, or we developed at the Children's Hospital of Philadelphia a leadership development program for up and coming, physician leaders, both men and women. And one of the sessions I just talk about, leadership moments, and then you kind of flip it on the audience and just say, okay, what would you do in these circumstances? And, so one of them I gave is, when I went to Philadelphia to the program at CHOP, the Children's Hospital. So it was a #1 institution in the country, but the particular program that I was involved with was failing on all accounts in terms of clinical service training and that. And then to make matters work, so I got hired to go in and rehab it. And the 4 individuals that were largely responsible had trained me. And so here I was, the student now, coming in as the boss. And so the question is, and I flip it to, the audience, say, what would you do? So here you are, 45 years old, and you're in this prestigious institution, this famous department, and the people that are in the way or created the problems are your former bosses. So it gets people to thinking. Anyways, it's leading people through those leadership moments that I think have value, to them. And once again, it gets back to that Jesuit influence about talking about your experience and teach on your experience, both the good and the bad.
I'm fortunate enough to be a father myself. And I think, from the very first time your child gets a runny nose, there's a rush of concern and emotion that comes with parenthood. The research that you've done, and you talked a little bit about, the percentages that have been, decreased, significantly from the research and practices. Can you talk a little bit about, or do you ever reflect, I guess, on what you've done and what your peers have done and the gains that have been made in pediatric medicine, and just think about those families who are in the midst of, if they're in the ICU, or if they're dealing with cardiac pediatric issues, it's terrifying, and talk a little bit about your research and kind of what drives you and your peers to keep going.
Yeah, I think the most important quality is to be empathetic. And so you've got to put yourself in those shoes, those parents who see that their child was critically injured, is now laying there with all kinds of, devices and tubes, maybe on a ventilator and things like that. To sort of put yourself in their shoes, the same way as, put yourself as a patient there, as a child. And so you begin to, understand. I think that that's one of the two or three most important things as a physician, to be empathetic, so you can really come across. I think you can more effectively, communicate with them. But there's a fine line. I remember very early on in my training, as a resident, taking care of a child with a brain tumor, and all of a sudden I just got stuck. I couldn't, I got emotionally involved and everything else like that, and it just froze me, and so I wasn't of help to the family, certainly to the patients, and this went on. And finally, what happened, what I realized was, and then this is an important lesson for me, is that I was stuck because this child, it was a 4-year-old child, I still remember, it looked exactly like one of my daughters, and I just thought to myself, that's my daughter there. But I went beyond the empathy and just kind of, got emotional. And so I had to, I learned, you pull back. You don't pull back on the family and the patient. You still understand their needs and stuff like that. But in the end, they want you to do your job. So it was an important, lesson for me. So if I've been effective in these critical situations, it's, basically focus on doing your job and doing it well, not coming, to understand the patient and the family, to be empathetic to them, but don't get so immobilized that you can't help them at all. Don't freeze, basically, I guess is the right term.
So, we have young men who are, in the midst of a pandemic, learning virtually through their iPads, and that we were in class, for most of the first half of the school year, and we're going to be back in the classroom shortly. But as you kind of remember and think back to when you were a young man in their shoes, and then you using the lens of your career, do you have any advice or insights that you'd like to share with this next generation of Crusaders?
Yeah, absolutely. I think that's a great question. Paul, so after 35 or 40 years as a physician, as a father, a husband, as a citizen, so I mean, there are a number of things. First and foremost, just you got to follow your passion, and really commit to that. And that's, when I seek new trainees or new people coming in, I try to figure out where's their passion, and it doesn't match with our situation, because that's so important, because you're going to deal with the ups and downs, the things like you're talking about, like COVID and the frustrations of virtual learning. But if you're really passionate about it, you'll get over that. And so that's a key thing. There's no substitute for hard work, focus, and courage. And that's the thing that was imprinted on me there at Canisius. That discipline. It wasn't easy for me. I had certainly others in the room that were much smarter than me. I just had to work harder, and I had to stay more focused, and then have the courage and the conviction to commit to certain things. Another thing that I learned while there, I mean, the whole notion of a wisdom of teams, that even in something like medicine, it nowadays more than ever, like in an ICU environment and an OR, it's not individuals. I mean, they're individuals and trained differently, but how you function as a team will determine the outcome. And so there's wisdom in that team. It's that old saying, if you want to go fast, do it alone. If you want to go further and farther, do it together. And so that's certainly you know, very true. And I learned that in so many ways at Canisius. I grew up with a love of basketball. I played 4 years there at Canisius. There, the coach was a famous. I think he's in the Hall of Fame now. I know he is. Connie McGillicuddy there, and you know, in my you know, my senior year, I was blessed with the opportunity to be a co-captain with my fellow guard. We both eventually achieved all ACC, but what we really figured out, we're a bunch of 4, 5, 6 people that we didn't look like, we were underperformers. It looked like that. You know, our team, people didn't give it, but the way we functioned as a team, we actually got to the you know, to the state finals, where we lost by a point. But you know, it was that teamwork, and so and then another thing is, you know, we're all given. You know, I talked earlier about we're given these incredible gifts, the gifts of education. You know, this opportunity to spend 4 years at Canisius, and then for me to, you know, matriculate at Notre Dame, and then in Texas, and then University of Pennsylvania and Duke and stuff. You know, those are really gifts, and so it's incumbent upon us to kind of give back. You know, to share our talent, to share our time, and share our treasure with that. And so I think you'll find over time that that's really important. And then just 2 other things. One is I don't take myself very seriously. I try to use humor, particularly self-deprecating humor about myself, just to stay humble and honest and things like that. And then if you look at my you know, my journey that I described earlier, it's basically one of lifelong learning. You know, it helped. It got catalyzed there at Canisius, but every step of the way, whether it was you know, university, medical school, training, even now in the laboratory or in a clinical setting, you're always learning. And so that if you have that zest, it keeps it interesting and keeps you kind of you know, engaged in the process.
Dr. Greeley, thank you so much for spending some time with us today. We wish you and your family happy holidays and a Merry Christmas. And you know, I know just from being with you this afternoon that our students are going to take a lot from your words of wisdom. So thank you for sharing your time. Thank you for sharing your talent and the treasure of your career with us this afternoon.
Yeah, I would thank you, Paul, for this opportunity. I wish the students all well. I hope that everyone is able to maintain their health. We'll get over this. And if I can be of any assistance to any other individuals there, feel free to you know, to reach out to me if there's something about my journey that you have questions about or similar, and if I can help. It's ways I can still give back, you know, to Canisius. So, and thank you.